The Department of Health is here this evening. I'm Dr. Simmons from the Department of Health. I'd like to introduce a request to allow us to replace a current current receptionist position with a medical clerk typist position. This would allow us to cross-train within our clinic and our dental staff and improving our efficiency. The request amends and reflects a 3-month salary for the remainder of 2024.
Replace, okay. So we actually have a receptionist though?
It's a vacant position for the receptionist. We have not been able to recruit, so we are going to change the position over to a medical typist. And that would allow us to hopefully find someone and have that person, like I said, cross-train within the department so that they could work both in dental and in the STI immunization clinic as receptionists.
Okay. Does anybody have any other questions regarding this? If not, can we get a motion?
Make a motion.
Motion by Beston, second by Miller. All those in favor?
Aye.
Any opposed? Thank you, passed unanimously. Move on to item number 4.
Item 4 is amending the 2024 Department of Mental Health budget for personnel adjustments. The Department of Mental Health is here this evening.
Good evening, everybody.
Good evening.
How are you doing? Madam Chairman, with your permission, we would like to adjust the one of our personnel items in the budget. We have some account clerk 2s and 1s, and we would like to amend our budget to escalate those positions to some account 3 positions. We're having some difficulty with recruitment and retention. We're at risk for losing some very seasoned staff in that capacity. It would be budget neutral because it would streamline some of the processes and allow some individuals to advance to different positions within the department.
You know, it seems that staffing, I don't care what agency you're talking about, staffing seems to be an issue, so.
It really is.
Sorry that you're having to do this, but you seem to have found a solution. Are there any questions pertaining to this item? If not, can we get a motion? Motion by Miller, second by Ms. Petto. Whoever's name I can call out. All those in favor?
Aye.
Any opposed? Thank you very much. Passed unanimously.
Thank you.
Item 5 is authorizing an agreement with the New York State Office of Addiction Services and Supports regarding the electronic medical records implementation grant and amending the 2024 Department of Mental Health budget.
Thank you. So this is a fully funded state item. It is grant item from OASIS. We would like permission to accept this award of $120,000. It would be $60,000 in 2024 and $60,000 in 2025. And what that would allow us to do is right now through OMH, Office of Mental Health, we're able to generate reports automatically and input information automatically, and we can't do that with OASIS right now. We have to manually enter and manually use spreadsheets to be able to print up reports. By accepting this funding, we would be able to expedite that process and automate that process and really allow us to move into this particular time period in a more efficient manner. It would also allow staff to have more time to do their jobs and not be manually data entering information.
Does this have like the shared information capability, or is it just with internal?
So this is actually our ability to get information from OASIS. Right now, we are required by state to enter in certain submission information to them about who we're admitting, what services we're providing, different kinds of things like that. But also we're asked by the legislature and by community members for information related to those that are in our OASIS programs. And right now we have to do everything manually. So this would allow us to be able to answer those questions much more efficiently.
Any questions? If not, can I get a motion?
Make a motion.
Motion by Ward, second by Preston. All those in favor?
Aye.
Opposed? Thank you very much. Passed unanimously. Move on.
Item 6 is authorizing the submission of our grant application to the United States Department of Justice, Bureau of Justice Assistance regarding the fiscal year 24 comprehensive opioid stimulant and substance use site-based program grant.
So this is an opportunity through COSUP, which is a grant opportunity that has been offered to the county previously in other capacities. Currently, we have a clinical program through COSUP that we do with LEAD to offer services, clinical mental health services to individuals who are struggling with criminal justice issues. This is a different COSUP grant. It would be 100% federally funded. It would be over the course of 3 years. It would be close to $1.3 million if awarded the grant for your consideration. And what we would like to do with it is expand our motor team to specifically work with the criminal justice involved individuals. So that, as you know, the opioid epidemic is a huge issue in this area. Mortality rates continue to trend upward. And we are just not able with our current team to be able to meet all the needs of those individuals that are struggling with those addiction issues. So this would allow us to not only expand that team, but to work specifically with those who had criminal justice involvement. And just as a matter of interest, right now there's 1,349 individuals in Albany County so far in 2024 that are being served in OASIS programs. 626 of them are involved in the criminal justice, have been involved with criminal justice issues and involvement. So that's just the people we serve in OASIS programs. Think about all those individuals that we're not reaching, that we could reach if we could expand into other municipalities. This is a community program, they're mobile, so it's not a site-based program. We would go to them.
How many teams do you have that outreach?
Right now we have one, and then there is another one that's being explored through opioid settlement funds, but those are regular motor programs. What's special about this one is it would be specifically working with folks that have criminal justice involvement to really reduce recidivism and incarceration. And we're also looking for one of the positions through this grant to be a community liaison, so that person could provide education to the community and go out into different areas and really educate people about substance use and opioid use, but also about the motor program and the utilization of that program. We would also work conjunctively with Albany County Probation in terms of people that they were seeing and serving, so that we could help to maybe reduce the rates that those individuals end up reincarcerated. And we would contract with SUNY Albany to do a fidelity study to ensure the success of the program if awarded this grant. This is just, right now we are just exploring this grant, but if awarded, that's what we would seek to do.
Proactive, yeah. Any other questions? If not, can I get a motion? Motion by Beston, second by Miller. All those in favor?
Aye.
Any opposed? Thank you very much. Passed unanimously.
Thank you.
Final item on the agenda.
Item 7 is authorizing an agreement with Rehabilitation Support Services regarding case management services for the county reentry program.
So as you're all aware, we currently have a contract to the Department of Criminal Justice Services to provide reentry services to individuals that are incarcerated in prisons. And we have been for many, many years actively serving those individuals. This particular contract we put out an RFP this year for a subcontractor who provides the case management services for that grant. And we only had one responder to the bid, and it was RSS, and that is the person that the organization we were working with previously. They were a good partner. They really did a great job serving those individuals, and we believe would continue to do so. And so we're asking your permission to enter back into contract again with them for the year-long grant. It's fully funded. It's in the amount of $203,961 for 1 year.
Okay. Does anybody?
Thank you.
Ms. Lockhart?
Thank you. The reentry program,
Yes.
I understand as part of it with RSS and their services and so forth. Are they also providing any housing? for the
Yes, so what they do is when an individual is coming out of prison, they'll have interreach to the prison and they'll have a case conference
Right.
related to the individual, what their needs are, and if the individual is in need of housing, that's one of the things that they will try to link them with.
And where would they link them?
It depends. So if it's somebody who has a sex offense history, there's more challenges, of course, as I'm
Right,
sure
right.
you're aware. So sometimes that poses some challenges. But typically, the people that we work with fall under certain compass levels. They have behavioral health issues, typically, the individuals we work with. So we're typically trying to link them with Office of Mental Health-based housing, supportive apartments, but at times independent apartments that are lower income levels so that it's affordable for them. We would certainly seek every opportunity to try to wrap that around them if possible. Once in a while, they do end up in a shelter. I'm not going to not be transparent, but when that's the case, we try to get them out of that situation as quickly as possible. We're not just working with them briefly, we're working with them until their goals are met. So if they do end up in a shelter, then we're going to work hard to try to get them everything they need so that they don't become reincarcerated again.
My memory serves me correct, when they first started the reentry program, they were linking them back to their families.
They do if that's an option,
So
yes.
that was always the first,
Yes,
are they still doing it?
yes. Yes,
And
and I
then sheltering
apologize,
is
I
the
should have
last
said that.
option.
Yes,
So if there isn't a family member, an appropriate family member?
yes.
To take them, that's when you go into these other?
Absolutely correct, yes.
Do you have any statistics that you can pass on to us about recidivism?
I sure do.
Okay.
Absolutely. With your permission, I'll send that after the fact, but I'm happy
Absolutely,
to
send
send
it to the whole.
100%, yeah. And we actually, not to offer extra information, but we have other statistics too. If you would like them, we can send them as well.
And one last question now. How long do you track the recidivism?
Let me actually, give me 1 second. We certainly track for a year. I have to double check if we track beyond that. So my current document here shows the last year of what occurred for individuals who were served by the reentry program. So like, just by way of example, we have whether they were successfully discharged, we have whether they ended up reincarcerated again, and if so, on what kind of crime.
Correct. Well, that would be an unsuccessful discharge. correct?
Well, they were successfully discharged when we discharged them, then we tracked them after the fact.
Okay.
And unfortunately, in a very small percentage of cases, I believe, they got reincarcerated. I think we're pretty successful, actually, in Albany County in terms of our statistics with the amount of people that do not end up reincarcerated. But I'm not going to say that it never happens, because it certainly does. But we'd be happy to pass
Sure,
along the
please.
statistics.
Would be interested. Thank you.
Thank you. Any other questions? Can we get a motion? Motion by Mr. Miller, second by Mr. Veston. All those in favor? Any opposed? Thank you very much. Passed unanimously. We'll now go back to item number 2.
Item 2 is local law number I for 2024,
Thank
local
you.
law of
Thank
the
you
County
very
of
much.
Albany, New York, amending Chapter 265 of the Albany County Code to update the tattoo code provisions. Mr. Fine is here.
Thank you. So we just had the public hearing for this on Tuesday. This law basically will modernize our tattoo health code, making it simplifying compliance and, most importantly, removing some obstacles that exist to holding tattoo conventions. Primarily, one that currently requires a portable sink at every tattoo station. So this would allow FDA-certified surgical scrub instead, and we worked in collaboration with the health department on this.
Does anybody have any questions regarding this? I know it was subject of 2 committee meetings last night.
I'd like to point out that I think the entire law committee went on it as a co-sponsor last night.
I think so.
And so I think it was fairly well received.
Yes, you're right. Was it the law
Thank you
committee?
for pointing that out.
Was it law?
And they're all in line for a tattoo at the first convention. Any other questions?
I'll make a
Comments?
motion to,
Make a motion, I've got a motion by Lockhart, second by Miller. All those in favor? Any opposed? Thank you very much. Passed unanimously. Can I get a motion to adjourn? Motion by Veston, second by Mr. Ward. All those in favor? Thank you very much for your time and attention. Have a